Welcome, everybody. My name is Zuhdi Jasser. I'm an internal medicine private practice doc in Phoenix, Arizona, and I'm the chair of the private practice physician section. We are excited to, in this webinar, launch our private practice physician section and introduce you to who we are, our leadership, the AMA's work in protecting private practice, and hopefully the beginning of a long relationship with all of you in our section. So today, what we plan to do, and I want to thank all of you for taking the time on your Sunday to join us. I know that there's a lot going on between your practices and family and other things, but hopefully the PPPS will add to the comfort of your life and another resource to make your quality of life better. We'll start with some introductions in the beginning. We will have a little overview that I'm going to give you of what the section is and how it evolved. We are blessed to have the contributions of some of our leadership from the AMA. Dr. Credell, Dr. Bailey, and Dr. McCamala will join us. And we're going to have an update on the AMA's work on behalf of private practice physicians from Dr. Tuddy and Dr. Blake, who will share some of the data and other research and background that the AMA has done. We'll look at how to impact policy through the section for those of you who are new or old who've been here with us for a while on how we see the section contributing to policy, and then some closing remarks. So before we get started, what I want to do is we had somewhere over 700 registrants. We've had a vibrant private practice community in our caucus, Congress, and now section. So what we want to do is get a little data on some of you and see so that you know who all is participating today, and also give you a sense of some of the demographics. So we're going to do a little poll. You can just hit the response for the questions as we go through them, and then hit submit. And we will cull the data. There's only 4 or 5 questions or so, but we will also do 2 of the questions at the end again, just so that if we miss people that log on late. So the first question is, what size is your practice? Are you in solo practice, 2 to 8 physicians, 9 to 50, or you're not in private practice? So just hit a response and then hit submit. And then once we have enough time to answer, we'll let you look at some of the results so you can see. So out of the 200 plus that we already have online, over 50% are solo practice, 2 to 8 physicians, 35%, 9 to 58%. So we are speaking to private practice docs. Next question. Next one we're going to talk about is which of you are in primary care versus non-primary care, especially now. After the pandemic, there's been a lot of questions about primary care docs. So if you could answer this and then hit submit, please. So almost 40% primary care, the rest are non-primary care subspecialties or other specialties. So again, speaks to the diversity of our section. Next question, we're going to look at geographic distribution, where you're all from, what part of the countries. In the HOD, in our private practice Congress meetings before we became a section, we had a wide distribution across the country. We'd like to see who came for our launch. 33% from the Northeast, 12% here in the Southwest, 13% in the West, 17% Southeast, 24% Midwest. That's pretty good distribution with diversity across the country. Thank you. And next, how long have you been in private practice? We'd like to see sort of distribution of experience. And we can see that 72% are over 16 years, 1 to 5 years, 11%, 6 to 15, 14, and 3% are not in private practice. Again, that speaks to a distribution that I think the AMA data bears out also, and we'll talk about that later. Last question, about your AMA membership status, just to see who all signed on, if you're an AMA member or not. And then we'll go on to our presentations today and introduction. All right, almost 70% of you AMA members, 31% are not. There will be opportunity for you all to sign on to join our section with a link that's going to be provided intermittently in the chat. It's a bit.ly link to join PPS. So if you're not a member, hopefully become a member and join our section also. So what I'd like to do is talk about what AMA sections do and what they are. I know many of you have been active in the AMA. We have a broad distribution of folks that have joined us today that have a long history and involvement. So sorry if I'm repeating some basics, but we wanted to make sure everyone that joins our section is sort of on the same page. And if you look at AMA sections, sort of a high level overview, they are divided into sort of interest-based groups, if you will. There's the life cycle-based groups that include the medical student section, resident fellow, young physician section, and then the senior physician section. There's also a demographic-based distribution of sections that includes international medical graduates, minority affairs section, and a women's physician section. And then the practice-based distribution, the academic physician section, integrated physicians practice section, the organized medical staff section, and then our newest section, which is the private practice physician section, and this is the launch of it. Our history, and we're going to get into that a little bit, but just to sort of make sure that we all know this is not a post-COVID pandemic response in the preservation of private practice. The AMA has long been quite interested and engaged in protecting and preserving private practice options. This started back from a resolution that I submitted to the House of Delegates in 2010, and I'll get to some of that history and how we evolved. But long before the pandemic, we've been working with the Council on Long Range Planning and looking at ways to hone in on how to not only protect private practice, but create an advocacy educational arm for that. So what does the private practice physicians and AMA sections do in general? Each section, as they create a forum for activism with the AMA, they basically develop and activate impactful policy on issues on relevance to the section and constituencies. So for the PPPS, our mission will be initially education on what are the areas of private practice that are vulnerable or need more attention, which ones are pretty solid, et cetera. So our activism initially will be the educational part. We cultivate the next generation of physician leaders and hone the leadership skills of established leaders. And the sections are sort of that farm team, if you will, of future leaders in the AMA. And also we engage our peers in the policymaking and other activities of the AMA and the sections. Now, let's talk a little bit about PPPS, the section that you're seeing the launch of right now. Our mission that has really stood the test of time over 10 years. Now, we're a section as of this month and as of approval by the HOD at its last meeting in November. But that evolution included a mission that for even before we were a section, we were a caucus initially that was 15 people in 2010 and quickly became a few hundred at the HOD, which is a large portion of the HOD. The mission is to preserve the freedom, independence, and integrity of private practice so that physicians who choose to practice in that setting can provide compassionate personal medical care for their patients. So really the key is diversity. We don't want to see the diversity of choices that physicians have in their practice, be it employed, be it academic, be it private practice, to preserve the private practice, if you will. Membership is open to any AMA member in a physician-owned private practice, and it includes those who are in a practice of 50 or fewer physicians and in which those physicians own a controlling interest. And there's the exact link. It'll be available to you in the chat. Again, if you don't fit the qualifications to be an active member, we have roles for membership to support us, for those who believe or used to be in private practice, et cetera, to contribute in many different ways. Please don't shy away from activism with us if you're not actively currently in a practice of 50 or less. Policy meetings include our policymaking assembly and also webinars and other events throughout the year. So once you get on the email list, watch your email to look for those opportunities and call to actions, if you will. And Dr. McAvoy, our vice chair, now delegate to the House, is going to later talk about sort of how that policy making works and how our governance works. Bottom line is, as far as our governance, for those of you who are new to sections, it's really similar to the HOD. You have an assembly of active members. That assembly elects a governing council that serves as the leadership and includes designated members and leadership. And then the governing council, would appoint committees to serve in various capacities. And stay tuned to your email to learn about what those committees will be and what roles you can all play in engaging your AMA. We'll make a couple plugs in this meeting for the upcoming meeting in June. We have our HOD meeting, the House of Delegate meeting that happens, the annual meeting in June, has happened always in June for many decades, as has the interim meeting in November. And before the HOD meets, the sections typically will meet that week before. This year, it's in a virtual format, obviously because of the fallout from the pandemic. It's going to be Saturday, June 5th from 2:30 to 5 o'clock. And it will be, that's Central Time in a virtual format. So please sign up, and you will have an opportunity to not only sign up as a member with the PPPS, but also to sign up for the meeting. Our key activities in our first meeting are going to be to develop policy and support to sort of begin the process of what our policies development process is going to be. And also we're going to have an educational program that will talk about some of the things we're going to introduce today and get a little deeper with more of a town hall type discussion about where we stand today and where we look to lead into the future. So please join us and become a voting member. So next, without further ado, it is my honor to introduce our AMA leadership. Just to let you know, the sections typically will have liaisons from the Board of Trustees of the AMA into the sections to maintain a direct communication. Many of the Board of Trustees have been involved at the ground level with the private practice physician section because so many of them are in private practice, and they've been involved in helping ambassador and steward the development of our section over time. So our three trustee liaisons include Dr. Russ Kreidel, the AMA Board of Trustees Chair. He's in private practice in facial, plastic, and reconstructive surgery from Houston, Texas. Dr. Susan Bailey is currently the AMA President. She's a private practice allergy immunologist from Fort Worth, Texas. And Dr. Bobby Mukamala, he is a chair-elect for the Board of Trustees, and he is a private practice ENT surgeon from Flint, Michigan. So I'll let them introduce each other, but I'll let Dr. Kreidel lead off. And thank you, Russ, for being here and for all your support of our section.
Well, thank you, Zudi, so much, and good afternoon to everyone. I'm Russ Kreidel, a private practice physician surgeon for over 30 years from Houston, Texas, and I also serve as chair of your AMA Board of Trustees. I think this is a great strengthening in our AMA efforts to preserve and make private practices thrive, the formation of this new section. And great thanks to Zudi Jasser, Barbara Hummel, Tim McAvoy, and many others who've made this possible, who have hung on over the years and worked diligently to make this section possible. From its earliest beginnings, the AMA has backed private practices of physicians. Even as late as 1983, 75.8% of all physicians had been in doctor-owned practices. But what's happened? Times have changed, and today only 44% are in private practice, with the numbers unfortunately decreasing on a daily basis. So why would this occur? Well, I don't need to outline for you, since we know that many of you are private practice doctors, the myriad of forces that have caused the demise, if not attack, on our practices. But I think one of the root mean causes of this is the employment of physicians by hospitals, who benefit from an unfair reimbursement system that gives hospitals a site of service differential that pays the hospitals much more for the services by physicians than if they were in private practice, and allows the hospitals to additionally charge a facility fee on every even simple doctor visits. Now, this huge differential gives the hospitals so much money that they can hire more doctors at a higher salary than they would get if they were in private practice, and still profit handsomely from the higher reimbursements. It also, unfortunately, gives hospitals control over what the doctors do or say, to whom they refer, how they spend their time, how they treat their patients. And there's a loss of autonomy there. And for some unknown reason, insurance companies gladly pay, and the government gladly pay, these higher fees to the hospitals, which increases the cost of medical care for all. Now, additionally, government red tape, documentation, and insurance prior authorizations have cost private practice doctors dearly, and has caused them to hire many more staff, increasing their overheads, which have been growing at a 30% rate, at the same time as Medicare reimbursement has only grown by a few percentage points. And all the while that the hospitals get an economic index increased on a yearly basis. And young physicians, they start out with huge medical student debt, with the prospects of huge malpractice costs, and they're turning away from private practice just on an economic basis. And they have no role models in their academic medical centers to show them the benefits of private practice, the wonderful autonomy to make one's own decisions, the ability to deliver cost-effective care and compassionate care, to be able to refer patients to the best doctor, not necessarily the doctor in that hospital system, and the one who will charge less than the hospital would for a similar service. Well, there must be a plurality of healthcare delivery in our country, and this is going to continue to foster competition. Consolidation, I think, will kill medicine and will decrease the quality of care. And so without private practice doctors, who's going to serve our rural communities? And those make up the majority of our country's landscape. Indeed, all these issues and many, many more are on the forefront of your American Medical Association. In fact, 13 of the 21 members of the AMA Board of Trustees are in private practices, working along with an incredible management team for the preservation and viability of private practices. And a huge portion of our advocacy efforts in Washington, and also in state legislators, is geared toward improving the situation for private practices. And we recently, for example, won a congressional approval for a delay in the 2% cut that we were all facing in Medicare payments. And we're working very diligently to stop a 4% proposed cut in 2022. So we work on many fronts. We work on prior authorization. And despite the fact that insurance companies promised to reduce that. It was really only talk. And so we've had to push legislative solutions to end these sometimes outrageous processes that consume days of physician and staff time. We continue to work on scope of practice creep, where those who are much less educated and trained would like to take our place without supervision and without the hours of training that we have had. And so, because we are in the danger of losing private practices, which would harm patient care, we're so pleased to see the formation of this critical section that will give private practice physicians an even greater dedicated voice in AMA's policymaking process and access to knowledge and resources to maintain the viability of private practice. Now, as it was stated by Dr. Jasser, while the formation of this section is timely given the impact of the pandemic on private practice, this section is not a reaction to that, but it has been longstanding effort for many, many years. The AMA is the physician's ally in patient care. You will soon hear from two other board members, our president and our chair-elect. And then after that, you're going to hear about AMA efforts on behalf of private practice physicians by Dr. Michael Tuddy. I thank you all for being here today and dedicating your time to ensuring the viability of private practice. And we look forward to seeing the growth of this critical section. And we will look to the PPPS to lead the way on addressing the issues that are most critical to private practice physicians. Thank you.
Good afternoon, everyone. I'm Dr. Susan Bailey. I'm an allergist immunologist in private practice for over 30 years in Fort Worth, Texas. I've never done much work in the hospital. My practice has been outpatient focused, and I've been active in the AMA since I was a medical student. I attended the first meeting of the women physicians section, and now being at the first meeting of the private practice physician section, I just consider it an amazing honor, and I'm so excited that this day has come. In my career in organized medicine, I have always seen things, obviously, through the lens of someone in private practice. When I was president of the Texas Medical Association 10 years ago, it was not hard to do that because so many of my colleagues and so many of the physicians active in the TMA were also in private practice. But as I have risen in the ranks of the AMA, first on AMA's Council on Medical Education, then as vice speaker and speaker, and now as president, I have always made sure that the voice of the physician in private practice was heard. And that our unique concerns were recognized. When I became president last year, my theme was let doctors be doctors. I wanted to work on relieving administrative burdens that we face, getting rid of unnecessary paperwork and overhead, fight prior authorizations, as Dr. Kreidel said, and just in any, EMRs, MIPS, the hospital mergers, all these things that are making it more difficult for us to practice, and especially preserving the sanctity of the patient-physician relationship and fighting anything that comes between us and our patients. Well, the pandemic began just as I was getting ready to become AMA president late last spring. And it really didn't change my theme. If anything, it made it more acute and more important to let doctors be doctors. It just kind of changed our tactics and strategy. Early on in the pandemic, of course, we became aware of the critical need for PPE and how especially difficult it was for us to obtain decent PPE if we were not in a hospital setting or part of a large hospital system. My supply chain certainly didn't have masks in it, and I bet a bunch of yours didn't either. So I was searching for masks on Google and eBay and Amazon and whatever. It was incredible. And so my predecessor, Dr. Patrice Harris, actually discussed this with the White House last spring, how important it was to get PPE to doctors, how it was impossible for us to compete on price and volume for PPE. And we're still working on it. The AMA has fought throughout the various stimulus packages that have been passed during COVID, to make sure that doctors in private practice were taken care of, recognizing the unique problems that we had with being able, if not being shut down completely, at least not being able to see patients in our offices because of local restrictions or PPE limits. And then the Paycheck Protection Program and the other stimulus packages that came in. AMA has worked hard to make sure that we had access to those. And now that all along, burnout was at a terrible, terrible peak before the pandemic began. And that certainly has gotten much worse during the pandemic. So physician health and wellness has been a priority, fighting burnout, trying to prevent physician suicide, and just recapturing the joy that all of us must have in practicing medicine and taking care of our patients. I have been focused on the educational efforts of the AMA to teach physicians about COVID, and then especially about COVID vaccines. We have sponsored half a dozen webinars. We're going to have another one this week with the FDA and the CDC, live webinars where physicians can submit their questions, and I asked them. I moderated all these sessions, and have just gotten some incredible information, because we knew that if we did not feel comfortable with the new vaccines that were coming out, especially the mRNA vaccines, because that was such a new thing, that we would never convince our patients to be comfortable. And so we worked very, very hard on making sure that the efforts of the FDA and the CDC were as transparent as possible. And now working still to improve vaccine confidence in various communities, but also sounding I wouldn't really call it an alarm, but making sure that the Biden administration, at the CDC, and everybody that will listen understands that we need to get more vaccines in physicians' private offices to give their patients. If there's anyone that a patient is going to have trust in and going to listen to, it's us. Data has shown that patients trust their physicians when it comes to making important medical decisions, and COVID vaccination certainly is one of those. And so we need to get vaccines in our offices, because we all know that sometimes there might just be a very small window where that patient might say, okay, go ahead. Let's go ahead and do it. They may have changed their mind by the time they got to the car if we, hadn't given them the vaccine then. So that is one thing that I'm working on very hard, and I'm hoping we're going to hear some more from the White House about that very soon. So in closing, I would like to thank, first of all, everybody for giving me the opportunity to be president of the AMA. It's an incredible honor. It didn't look anything like I thought it was going to look, but nobody's 2020 and early 2021 have looked like we thought it was going to look. So thanks to Dr. Jasser, Dr. McAvoy, Dr. Hummel. These folks have been working so hard and have been so dedicated to the creation of this section. They have been our champions. They will continue to be our champions. And I hope we've got new champions in the audience today. So thank you so much for joining us. And I'm going to now turn the mic over to Dr. McCamala, our AMA chair-elect.
Thank you very much, Dr. Bailey. Bobby McCamala again, an otolaryngologist here in Flint, Michigan, where I share an office with my wife, Nita, whose desk is right behind me, an OBGYN for the past 21 years and counting. You heard a lot about the work already. I'll just highlight some of the things that really resonate with me, particularly our advocacy work here at the AMA, that makes our ability to take care of our patients so much more satisfying. Something as simple as I turn on the TV and I see all the pharmaceutical advertisements, and then I've gotten in the habit of Googling how much each of these drugs cost. the thousands of dollars a month related to that, and the effect that that has on our healthcare system. And so a lot of work that the AMA is doing to make sure that patients can hear, for example, from pharmacists about when a lower cost option is available. I mean, something that seems so common sense, but something that those pharmacists were banned from doing were it not for the advocacy of our AMA. COVID related, you heard a lot about that already from Dr. Bailey. Something as simple as Medicare reimbursements to physicians for vaccinations, physicians' office access to vaccinations, and then things like MIPS, the merit-based incentive program that sort of sometimes is the bane of our existence as we're trying to sort of deal with all of these things that come our way and requirements, just getting some relief from that during COVID as we're just trying to sort of take care of our patients and keep our practices going. And then telehealth, right? We've all seen how that has evolved in its role in taking care of our patients because of COVID, but clearly we can all see the role of that post-COVID and the importance of it. So making sure that payments remains available for telehealth care after COVID. Russ mentioned the scope of practice partnership. Here in Michigan right now, we're dealing with a bill that would give nurse anesthetists completely independent practice to practice anesthesiology, basically. And we have received through the AMA Scope of Practice Partnership a grant to help us to fight that battle in our state legislature. Another example that's, it seems so odd that this is even possible, but the litigation center really came in to help when an entire hospital removed the whole medical staff and tried to replace it with a hand-picked medical staff. It's crazy as it sounds. It happens, and it happens across the country to varying degrees. And were it not for something like our AMA and its litigation center to be able to sort of be a barrier to that, then independent physicians like us have no ability to fight that. We're going to hear soon about the specific work as it relates to those of us in private practice from other folks here. But what I will say is that, the winds of time have blown many physicians away from private practice and into the arms of institutions and hospitals. But the AMA is working hard to be a barrier to those winds, to keep private practice viable and an attractive option, not just for us, but for those that are coming in to replace us, right? I've already seen in chat, about difficulty finding successors to our practices, right? Something that we work so hard on, just to have to walk away from it and not be able to hand it to somebody that's going to continue to take care of our patients and make a living for themselves in it, is something that really we need to work on. So the private practice section will play an important role in these efforts, and I look forward to your involvement in it. And now I'll turn it back over to Dr. Jasser as we prepare to hear more from our AMA and folks at the AMA for our work on behalf of private practices like yours and mine.
Thank you, Dr. McCamala. Thank you, Dr. Bailey and Dr. Kreidel. As all of you can see, we have unbelievable support from the highest leadership in the AMA, and not only support, but shared experiences in their private practices. So this is a natural phenomenon. As I looked through the chat, I see a lot of voices of folks saying thank you for the development now of role models, of a resource for expertise. And I can tell you, as we were developing the group that ultimately formed this section over the last 10 years, many of us in small practices, what we're missing and why many of us join our state medical society and the AMA is we're missing that institution that we can lean on for questions and for support and advocacy, since often physicians involved in larger institutions have their own institution to lean on initially. And that's really what this section hopes to begin to augment. So thank you for all your comments. We're logging them. Today's introductory foundational webinar will hopefully launch things, and then you'll have multiple opportunities in the future to engage. To that point, I want to take the moment now to introduce and let them say a few words, my fellow leaders at the private practice physician section. I'll introduce Dr. Tim McAvoy first. He is has been our vice chair for many years and will soon be our delegate. He's in private practice in Wisconsin, in Milwaukee, Wisconsin. And then Dr. Barbara Hummel, who's been our secretary treasurer for a number of years. She's in private practice also in Wisconsin, and she is soon to be our chair-elect. So Dr. McAvoy, a few comments.
Yeah, thank you so much, Dr. Zudi. It's just been great to see the chats. Like Bobby was saying, we're getting a good group together. There's a lot of enthusiasm. I think that this is a great time to turn it over to Dr. Hummel, since I'll speak later. Thank you.
Thanks, Tim.
Thank you. I have to tell you, I'm also a solo family physician, and I've been in practice a few more years than I'd like to think. I remember attending the second private practice Congress, or I guess at that point we were a
Caucus.
caucus meeting. I was so impressed that I just decided to stick around. I ended up actually being in charge of keeping track of our membership. I also was in charge of setting up our meetings at the interim and the annual meetings of the AMA. And I was able to set up a number of education programs for our residents and students over the years. And it's been an absolute incredible journey. And I'm so thrilled that we stuck it out, and we're now going to be able to see the fruits of our labor for all those years. And thank you everyone for joining us. And I hope to see so many of you when we do get together in the future.
Thank you, Barb. And their co-leadership has just been amazing, and it would not have happened without them. And also, I know online we have a significantly very active section that shares a lot of stories, anecdotes, and resources, and help communicating virtually with each other for many years. So thank you, all of you, for being here with us that have long been supporting. Next, while 15, 20 minutes will not do it justice, it is a great introduction for us to talk about an update on the AMA's work on behalf of private practice physicians. And the AMA has for a number of years been researching and doing a lot of work on data regarding the future and past of private practice physicians, and our in-house experts, if you will, are Dr. Michael Tuddy. He's the AMA Group Vice President, Physician Satisfaction and Practice Sustainability, and Dr. Kathleen Blake. She's the AMA Vice President of Healthcare Quality. So I'll turn it over to them to share some of the AMA's work over the past many years on these areas.
Thank you, Dr. Jasser, and I really appreciate being here today. And I thank all of those who've logged in on this Sunday afternoon to learn more about this new section. The AMA has been and continues to be committed to supporting private practice physicians. Where does this fit in to the larger AMA strategy? It is part of our work in our removing obstacles that interfere with patient care strategic arcs. We have 3 overall strategic arcs of strategy we work on. Removing obstacles that interfere with patient care is one of our key arcs that Dr. Blake and I work in our professional satisfaction and practice sustainability unit. Our other 2 arcs are working on issues related to chronic disease and lifelong learning and professional development. The arcs are supported by 3 accelerators, work around innovation, advocacy, and health equity. And it's together, when we pull these tools together, that we can really have an impact to support physicians. So our unit was created about 8 years ago, and we've been putting together resources and tools to help the profession. Tools that we've identified issues through our research and talking with physicians, and other times pivoting, like we did in this last year, to create numerous resources related to things related to COVID, taking advantage of government payment programs, to tools specifically around adopting and accelerating the use of telemedicine. But we don't rest on our laurels. We're always trying to understand the issues and develop the resources and tools and support our advocacy colleagues with the information they need to be strong advocates for the benefit of our physicians. So we've developed a conceptual framework that really starts with research. And we do lots of research that we've published white papers on and published peer review, from our initial RAND study in 2014 that identified the factors that drove professional satisfaction, to things like our time study we published in Annals of Internal Medicine in 2016 that showed for every hour physicians spend with patients, they spend nearly 2 additional hours doing administrative and EHR work, to more recent reports and papers on EHR usability. In a paper we published last year that showed physicians are actually more resilient than the general population. And this issue of burnout is not a resiliency issue, but really a problem with the environment that is created in the current system that we have. That research leads us to developing the tools and resources that we create. We pilot them and work with physicians. Last year, we piloted with a group of practices in Texas, Massachusetts, and Florida, working with the Texas Medical Association, Massachusetts Medical Society, and Florida Medical Association to work with helping these practices adopt telemedicine. We created that pre-COVID, and as you can imagine how successful that was to work with these practices and learn from them as we then refine our tools and resources and expand the outreach and scale our efforts. Finally, we like to recognize success, telling those stories, those case studies of those who've done it well, and share that information with each of you. And I couldn't be more excited that this private practice physician section has been established. It allows us to learn from you, and you have a voice directly to us that we can identify the issues and continue to address them. And as I said, we've continued to work on this conceptual framework. In this past year, we've done additional research specific to private practice physicians, qualitative interviews of physicians who have identified themselves through the MIPS work and other data as high performing, to learn what high performing private practices have accomplished so that we can take those lessons and expand them. To talk a little bit about this research, and we'll delve more of it into the June meeting, is my colleague, Dr. Kathy Blake. Kathy?
There we go. Thank you, Michael, and thank you to all of you who have come out on a Sunday to be able to really experience the exciting launch of this section. Maybe just as a prelude to my remarks about our recent research, I recognize so many of your names. I'm a former member of the AMA House of Delegates from New Mexico, and certainly my drive to be involved in the AMA and to be a member of the sections that were available to me at that time was, you can think of the sections as your neighborhood. And so it was a way of making a large organization a neighborhood. And so our hope with this section, and I'm sure it's true for all the leaders of this section, for the staff who will be managing it, our hope within professional satisfaction practice sustainability is to create a neighborhood. So in terms of the research that we've done, and Michael mentioned just briefly the RAND studies, which have been the foundational findings, the motivation for the work that's being done for all physicians, but particularly for this group, is that physicians at the end of the day want to know when they go home that their patients have been well taken care of, that they've done a good job, and that they can be home. And as Michael said, what we've learned is that oftentimes you don't have that experience, that it may be that you are still doing electronic health record systems, or you're trying to make up for systems problems that have interfered with your efficiency in the course of the day. So our unit is dedicated to that. A lot of what we've learned, I should say, from our research applies broadly. But what we did with our recent research, and I am not going to share all the results with you, we are still analyzing them, but we wanted to find out and talk to physicians who were in so-called high-performing physician-owned practices. And we spoke with 25 practices from all over the country, and we defined the high performance going into the study because we realized that there was no single agreed upon definition, and decided that because many private practice physicians would be in the MIPS program, that the entry for the study would first be based on getting a score of 70 or higher in the MIPS scoring system in 2017, the earliest or the most recent data, excuse me, that we had available to us. What was of interest to us was we wanted to know what was the secret sauce, what made the practice high performing. And interestingly, the physicians themselves, when we reached out to them and they agreed to be interviewed, oftentimes didn't see themselves that way. that they didn't realize almost that they were at a high level in terms of national recognition in this program. But what they told us is they said that they had tremendous pride in their practices, that they appreciated the team that they had been able to gather around them, be that other physicians, be it their medical assistants, their front office people, that they really had a strong sense of ownership, not just on a business basis, but on a self-identification. This is my reputation, and this is my contribution to the community. They, like many other physicians, told us that they had particular areas, and I've been watching the chat. So some of you have talked about the challenge of recruitment and retention of younger physicians. There was a bit of a sense of just not being visible. So we realized one of the things that we will do as the AMA is find more ways for the private practice experience to be made visible to the medical students, the residents, house officers, so that they can make what we would call a fully informed decision about the practice that they will start out in. The other thing that they found was that they told us that they had electronic health record systems, but they knew they wanted to do a better job of leveraging that technology. So we'll be working on that. And then the whole issue of contracting can sometimes be arduous. I know it. I had a practice which I ran of 26 cardiologists, cardiac surgeons, and vascular surgeons. Talk about challenging and figuring out how to get everybody on the same page with all the necessary information to be able to do contracting. And then a variety of other areas. But one that I want to highlight, because it is part of the value of this section being established now, is the value of having colleagues who you can reach out to, who you can talk to. Because many of the physicians that we interviewed said, we kind of feel like we're out here by ourselves. And sometimes it was because they were in a solo practice, or they were in a practice that was relatively small, or they were in a rural area. And so they were looking for community. So our study, which was done, planned, launched pre-COVID, quite frankly, could not have been better timed with the establishment of this section, the gathering of all of you here today, and the chance then really to create that community. So with that, I will pause and turn it over, I think, to my colleagues, and particularly to Dr. Jasser and Dr. McAvoy.
Thank you. Thank you, Dr. Blake. Thank you, Dr. Tuddy. I'm going to take a moment to ask all of you if you have questions specifically. We have one more presentation from Dr. McAvoy, but in the meantime, if you have questions for Dr. Tuddy, Dr. Blake, our AMA leadership from the board, I believe they're still on with us. So, or from your new section leadership, myself, Dr. McAvoy, we're going to take 5-10 minutes at the end in a few minutes here to address some of those. So we're seeing your comments, but if you have specific questions, please either put in the Q&A or in the chat, and we can address it. Thank you, Dr. Blake, for your, and I think a lot of the data that she just presented and Dr. Tuddy mentioned really mirrors the feeling we've had, is that we've not had an institution to lean on, and the private practice physician section will create a forum officially. Not that, the AMA has been doing this anyway in many ways, but we just didn't have a forum to be made aware of it. And now that's what the PPPS hopefully will do. Some of you asked about hospital privileges and also larger practices. There is some overlap. The OMSS exists. It's been a section for a long time, the organized medical staff section. And obviously the overlap with private practice and hospital privileges, we are working very closely with Dr. Gold and the other leadership at the OMSS. So as you become members of our section, you'll be able to hopefully engage those sections. There's also the IPPS, which is the Integrated Practice Physician section. And that probably, and look at what they do. It's larger practices of 200, 300 to 1,000 docs, if you will. Having said that, I want Tim now to introduce you to how we are going to make policy, how sections make policy, and specifically how the private practice physician section will make policy. Dr. McAvoy.
And thank you so much, Dr. Jazeera, again. I want to amplify that remark about the OMSS as the organization that we will partner with, and both Dr. Welch, their chair of their governing council, and Dr. Gold, their delegate, have reached out to us and are both attending this section. So thank you, Dave, and thank you, Matt, for doing that. Russ Libby, who is the delegate for the integrative physician practice section, is in an airplane right now, or he would have been on this meeting as well, but we're planning on putting a resolution in with IPPS if that is what our governing council and assembly so choose. So writing AMA resolutions is a little bit of an art. Many of you have this skill set because you're 2/3 of, when we did the original poll, or 70% were AMA members, many of whom we know have been in our House of Delegates. But that means 30% of you are not, and it'll all be Greek to you. But the way resolutions can come from any AMA member, and they can come from a variety of different ways. The way we'll do it is our members will write resolutions. They can post them on our listserv, or Dr. Heine was talking about Facebook, but any one of our multiple media outlets, you could bring it. This would be a good idea for resolution, as people are doing on the chat. The assembly will debate them, alter them, and likely we will at some point in time have a council to vet them and to change them. They will then be brought to the House of Delegates, where your delegate and your alternate delegate, by the way, a little advertisement, we still have an alternate delegate slot available for someone who has AMA experience and can hit the ground running in a virtual session. We will bring them to the House of Delegates. Now, this annual House of Delegates is going to be extraordinarily unusual because it'll be our first annual meeting that is virtual. We did have a virtual meeting at interim, and interim resolutions are limited by a resolution committee that goes over them and finds whether they are germane or not to for advocacy. But our speakers have asked us to hold all the resolutions down to a bare minimum, by which they mean 1, 2, or 3 or less. So we will be very mindful of what our speakers need to have to conduct a meeting, but hopefully we'll all be together in Orlando and we will be face to face and functioning like a normal section then. So if you have a good idea, like my idea about workman's comp, for many of you know I was deathly ill with COVID this last winter, and the workman's comp insurance was less than sympathetic. So I would put one together for myself, but not this year. So we need the ones that are completely fundamental to what private practice does and needs to be doing now. Some of you are hitting on those themes now, but then we will need to have these things adopted by the House of Delegates, become AMA policy, and that's when our staff and our leadership will be able to make things happen if the timing is right. Because for a lot of times, and I think of our House and our Board of Trustees fight with SGR for a decade before we finally got that dragon slain, and now they're starting the same fight all over again. There will be things that will take priority, but if you come up with a good idea and we can make it into policy, and the policy timing is right, then it can happen. So, there's lots else that we could say now, but I want to save the time for Dr. Jazeera to do the questions again. And just to say one more time, we are looking for candidates to be an alternate delegate for our section at this annual meeting. Thank you so much, Dr. Jazeera. Let me turn it back over to you.
Thank you, Tim. It's always a pleasure to work with you. So now we want to end on some closing call to actions, if you will, and then we'll address some of the Q&A that has come up. And first of all, please make sure if there's anything you do, go to our private practice physician section webpage to learn more about our section and how the AMA supports private practice physicians, and then become a PPPS member. It's a really simple application. Already some of you have put in the link, and Keith put it up there right now, how easy it is to sign up. And then attend the June meeting. The June meeting is open to all AMA members that are part of our section. While we meet right before the House of Delegates, the House of Delegates is limited to delegates from states and alternate delegates, et cetera, but the PPPS section is open to everybody to attend our meeting that qualifies as members or is interested in the section. So please sign up for the meeting in June, and I gave you the date earlier, and then participate year-round. We'll have newsletters, we'll have engagement opportunities on discussion groups and other things. There was a question in the chat about whether this is just an interest group. No, we've been an interest group for about 10 years plus since the resolution I authored calling for this. But with the ushering and ambassadorship of AMA leadership, and with the brass tacks of staff and others, we have now officially become a section. Was passed by the HOD, and we couldn't do things like this without the support of staff and the resources of the AMA. And I want to thank the staff, including Keith Voog, Jason Ranville, and Kerry Waller and their entire team that have made this possible. We couldn't have done it without all of their work, as you can see on a weekend. So now, without further ado, what I want to do is take the two or three of the poll questions. I can't remember if we're doing 2 or 3, but poll questions, because there's some people that have logged on since. We want to make sure we get some of the most important data. So let's look at your practice size. The reason the practice size is important to us is we want to make sure that we have representation on the governing council from diverse practice sizes. So please look at this. If you're solo, 2 to 8 or 9 to 40 physicians. I think they should say 50. Okay. And then just submit it, please. Okay, so 56% solo practice, 2 to 8, 31%, 9 to 48%. Thank you. And then the last poll question will be on whether you plan to attend the June meeting. We just want to get a sense of your engagement with us. So Saturday, June 5th is our first meeting. Okay, perfect. Thank you. And hopefully you can tell your colleagues. That's the other thing, your networks. You know, ever since we lost the connections with the doctor's lounge and other things in the hospitals that have become much more isolated as less physicians are rounding in the hospitals, et cetera, that's been harder to share. So make sure through your state medical societies, through your county medical societies, that you let folks know that the AMA has a private practice physician section, and begin to mirror those groups in your states, and hopefully become activated locally and nationally. So in the last few minutes, I want to address some of the questions here. The first one actually I want to do is from the Q&A, and hopefully the AMA leadership can address this, either Dr. Bailey, Dr. Kreidel. This is from Joel Chodos. What will the AMA actually propose to do in practical terms to reverse the process of private practice eroding into hospital employed physicians and getting new physicians to go into private practice? You've laid out the problem very well today, but what's the reality on moving forward into solving problems? And I think that's a good general question for the AMA leadership to address, and really what today is all about. So whichever, either Dr. Bailey or Dr. Kreidel, if you're available.
I'll start. I think Russ can add afterwards. You know, it's such a good question because it's, you know, recognizing the problem, of course, is always the first step to finding a solution to it. And I believe that private practice will become just inherently more palatable once we take the obstacles away from it. The fights for prior authorization, which just takes an inordinate amount of time and really harms our patients, as a recent AMA survey showed. Getting physicians paid, fighting big mergers that make it harder for us to compete in the marketplace. Getting rid of just these general administrative burdens that take us away from our patients. Russ, I don't know if you want to add any more to that.
Yes, Sue, I think, as I tried to mention, I think that one of the big things is the site of service differential, and we have worked on legislation to try and change that, because it makes no sense for hospitals to get paid the amount of money that they are. They can buy a physician's practice, he can deliver the same care, but then they can charge 3 times more for the same services that he did, and also have a hospital facility charge. And so this is now has to be a legislative thing. Obviously, the hospitals aren't going to support us, and so we have pursued this. And a lot of our advocacy is feet on the ground. We are there right now. It's computer on the ground, I guess, and virtually. But when the epidemic calms down, we'll be more in Washington than we ever were before. But we've done that by computer now. Working with legislators, there is a doctors caucus in DC. We work with them, and we call the legislators all the time to try and explain what this is doing. It makes no sense, because there's only a limited amount of money that the government is going to spend on healthcare, and that's why physician reimbursements don't get increased. If it goes to a hospital for not a reasonable purpose, then that's less money that the doctors are going to get. We're facing a lot of obstacles. Our friends, we don't have really true friends in the insurance industry at all. If you look at the pandemic, they turned out billions of dollars of profit in there. At the same time, the physicians had their bottom line decreased by 36%. So we have to explain this to Congress, legislators, not just on the national level, but on the state level. There are insurance commissioners in every state. And they control the non-ERISA plans that the state has. And so there's a need for every state legislature to deal with this issue. And there's an issue for the ERISA plans in Washington, D.C. So we have a whole team of advocacy at writing model legislation bills for states and proposing legislation for Congress. We just can't stop this. It's common sense. It's common sense what we're talking about, where it's common sense that we should get cost of living increases. I mean, there's just too much that is being pushed on the backs of physicians, on their altruism, that has to stop at some time, because their offices will close. And when offices close, then there's total consolidation, and then you have 9-to-5 doctors, no more continuity of care, and that's one of the beauties of medicine, of private practice, is following your patients, taking care of them night and day. And this is going to be lost, and that harms patient care. So legislatively, we have to do something about that, as well as with prior authorization. And we had a meeting with the insurance industry. They said they were going to do something to improve it, and they didn't. And so we have model legislation for states, and it's been passed in some states. We're going to continue that in Washington, D.C. We've been very fortunate that CMS and others in the administration have been responsive to our complaints about non-operability of electronic medical records so that records can be shared easily, which improves care. There's just a myriad of areas that we are chipping away bit by bit. We didn't cause these problems. Unfortunately, we don't have the financial reserves or lobbyists of insurance companies and hospitals. So we just have to work and be solidified. You know, it would be great if more of you who aren't AMA members would join. We need your numbers to say we represent more physicians. We're working hard for you. I know that's a communication thing. People think the AMA is the AMA of their father or their mother. It's not. It's totally changed. We are a vibrant advocacy organization working hard for you, and we need your support. We need you to join, and we need you to be active in your local areas too, through your state medical societies and through visiting your legislatures and legislators and telling them your story, telling them the problems that you're having when you try to get a patient approved for surgery, or you want a special test, or you want to get a medication that they've already used for a year, but the insurance company now says they're not going to cover anymore. But these are the kinds of things that they react to when their constituents are harmed. And you and I all know, we all know the harm that's caused by all these outrageous regulations and interferences with our practice. As Dr. Bailey said, let doctors be doctors. This is what we have to do. It's a question of standing up and speaking up and not saying, what are you doing for me, AMA, but what are we all doing together?
Thank you, Dr. Kreidel, and thank you, Dr. Bailey. I thought that question really sort of summarized some of the 30,000-foot view of what we're trying to do, and thank you for the detail in your answer. I have to tell you, I was not only in the medical student section when I was at the Medical College of Wisconsin, but then when I was in the Navy, I was active in the resident physician section. So the sections, like the HOD, are very, I mean, I've not been involved in a more democratic body that has the ability of any individual member to write a resolution. So if you see issues, and I see a lot of the questions here are very granular about specific things on contracting, on ACA 2.0 and other things, write a resolution and bring it to our body for, if not for this meeting, for the meeting in November. And it will quickly become discussed and hopefully passed or modified in a way that is commensurate with current or future policy changes. And it is an extremely deliberative democratic process where your voice can be heard. Maybe if Dr. Tuddy and Dr. Blake are still on, there's a question here about the resources available from Kevin Patterson about the resources available by the AMA for early career physicians to transition to private practice or start a private practice. Our section is going to become a form on the website link to a lot of that resources in the AMA. So take a look at that. But maybe if they want to talk about all the work they've been doing for long before our section now started.
Zudi, could I just make an announcement too?
Yeah, please.
For those people who don't feel that they know enough to write a resolution, if you just bring the ideas to us, Tim and I have, and even Zudi, we're all pretty well versed in how to write a resolution, and we'd be more than happy to help you do that.
Thank you.
Michael, why don't you go first and I'll fill in if need be.
Thank you, Kathy. Yeah, we do have a lot of resources on these, and we may not have them best organized on the website. So I think one of the things we'll work with the staff who support this new section is making sure that we organize that information better for you, because we do have a lot of content from various aspects around this that have been put together. But we definitely maybe need to organize that. So I think that's a great opportunity through the new private practice physician section webpage. And it's also going to be valuable as we think through meeting with all you and how we program and figuring out what additional educational content and resources that we can be providing by listening and really breaking down this problem, because I think of it as three problems. And we've talked about that. One is, how do we increase awareness that private practice is a valuable option for that medical students, residents should be thinking about, considering and realizing that they can take advantage of that. Second, how do we help those who want to move into private practice have the tools and resources to be successful? And finally, those who are in private practice, how do we continue to advocate to remove those barriers so they can continue to be successful in your chosen model of private practice? So we've got a lot of things, as Kathy can note, but I think we can do a little bit better job of making sure we organize those best for you.
So I might just add a real practical kind of boots on the ground, ready for you now suggestion, which is that AMA for a number of years has had the Steps Forward program. And so I would encourage anyone who is on this meeting to look at that. It is free of charge. It does not require AMA membership to be able to access the resources. But we now have, I think it's over 50, if not 60 modules about different topics that you can literally turn around, and I call it news you can use right away. The second, just to give some practical examples, we've developed a lot of resources around the evaluation and management code changes that went into effect January 1st. This has been a cross AMA effort, and it is particularly helpful because it also talks about the role of your staff to be able to assist with integrating this into workflow. For telehealth, you'll find resources in our telehealth playbook. So as you think of not just continuing to care for people in COVID times, but beyond that, you'll be able to see how to do that. And then I'll share with people that we have amongst the staff, we've realized the beauty of COVID is it has brought down silos that might have been there before or were an obstacle. So we now have an cross AMA work group led by Carol Vargo on our team that is looking at payment issues. So please, if there are payment issues, challenges, specifics that give us insight about what needs to be addressed, we would welcome those. And going back to this issue of how do you recruit and retain physicians so that they will come into your practices, we're already in conversations with the medical education unit, with the folks that are running the accelerating change in medical education, and working on ways to address some of the questions. I saw one question: how do you get trainees into private practice settings so that they see it in action? So stay tuned, but that is already subject of a lot of effort.
Okay, thank you so much, Dr. Blake. And again, I want to thank the staff for all the work in putting this together. There's so many other questions. I know you've all asked about resources. We tried to give you as much as we could today. There's going to be a lot more opportunities to do that. And I want to make a plug for social media. If you're on Twitter, on Facebook, whatever social media platform you're on, tell your friends about the link to join the private practice section on there, because, you know, in the virtual world, that's how we generate our community, is through every mechanism possible. Make a last pitch for the June 5 meeting, the private practice section a week before the HOD meets. So bring your ideas, and if you have ideas you'd like discussed or presented beforehand, let us know. And the staff will also put some folks have asked for some contact information, whether by email or otherwise. I know we gave you the link, but perhaps you're looking for emails or other ways to get in contact with leadership, which is written there. So maybe we can put that in the chat before we log off. So if there are no other comments from our leadership, I will close our meeting and adjourn, and thank all of you for the time. I mean, it's amazing to look how little drop off we had in the 75 minutes that we've been with you. So thank you. I know you're all engaged, and there's a lot more to come. And again, thanks for your support from the president on down. So God bless. Take care.